Okay, right. So this is you, I think.
Beef chain for
Yeah.
medical devices.
Yeah.
Problem: healthcare costs are skyrocketing, making access to healthcare difficult for many. This should and can be changed as soon as possible. Yep, I agree. In some states or countries, this is messed up. And solution is blockchain for medical devices, tracking, traceability, inventory management, patient safety, all this stuff. It just goes on. Yeah, I agree. I just recently came up from a Simpa Chain webinar and heard about Cool Chain, which is like now I'm putting marketing here, but they have like devices what go humidity and temperature, and they go with the vaccine box, and people and all of these like hospitals buy them and put them in, and they all the regulators, all the hospitals themselves, and everybody who's like connected have the like open platform where all the data is going, and it's verified and it's trusted, and that is what blockchain for. And Cardano has facilitated all this groundwork, and now we just need stuff like this on top of that. And so in the grand scheme, this is very important. And
Yeah. Although, yeah, there's definitely, you know, a pain point here which is being solved. However, I would question if beef chain is known well enough to use it as an example. I feel like, you know what I mean? It's not like saying Airbnb or Uber for, you know what I mean? So sort of like using an example which is not really actually that broadly known kind of thing. But yeah, I think I agree with everything that you said. Healthcare is super important, and again, like it's weird. It's a weird problem because depending on whatever geography you're from, it's different, right? So I don't know what it's like in Estonia, but in the UK here, we've got basically sort of, you know, nationalized healthcare with the National Health Service, and you know that's really different from, you know, how America approaches it, which is more private, you know, private healthcare insurance kind of thing. I mean, here in the UK, you can get private insurance, you know, healthcare insurance, but you have the huge sort of fallback, which is the publicly available. So it's definitely, you know, a huge potential for environments, and also maybe even places which have public healthcare. That won't always be the case, right? You know, it might be that you know, blockchain, you know, enabling a much better healthcare experience would mean that governments will then, you know, stop being the, you know, the providers of healthcare. So yeah, this is definitely an important problem to look into, and that's big picture.